sick and tired of turning away pediatric clients from your practice? Well, you're in luck, because today I'm going to talk to you all about Shonishin and how to really start getting results with it in your practice. Let's get into it. Hi, I'm Maya Suzuki, and I run both ShinKyu University, a worldwide platform to help acupuncturists transition their practice from TCM into traditional Japanese medicine. And I also run a small little clinic here in Colorado that caters 50% to pediatrics. Some of the results that I've seen here in my clinic, but also the results I've seen in my students' clinics, are really profound, and it makes me super excited to spread this amazing medicine of Shonishin. If you're really interested in building your Shonishin practice, again, Japanese acupuncture or acutherapy for children, I call it acupuncture without the puncture, then I would love to chat with you. Please do set up an interview. There's a link for that in the description box below. All right, let's get into it. First of all, Shonishin is, as I mentioned, a non-invasive, non-insertive, traditional Japanese medicine version of pediatric acupuncture. It is utilizing tools like teishins and enshins and chokishins and zanshins. There's so many shins. Shin just means needle. But in the end, it's really just acupuncture on the surface of the skin rather than insertive technique. So in order to really start having Shonishin in your practice, there's one thing that you must do. Actually, maybe two things that you must do. One is you're going to have to buy a teishin or a version of a Shonishin tool. And then the second is you're going to have to learn how to palpate. And when I mean palpate, you're going to have to be quick about it, because little kids, they don't sit still for nothing. Now, if you're interested in looking to buy a teishin, there are several local makers here in the United States. I also bring in tools from Alki, which is the top teishin tool maker in Japan. You can find those tools on shinkyuuni.org on my shop. So if you're interested in getting a tool, please do let me know in the comments below, and I'll help to guide you to a few good places to help you get a good tool for your practice. All right, so that comes to palpation. The most difficult thing to do with treating children, and I would say anybody at all, is really to have a dialed in palpation that truly tells you when to treat, how to treat, and when you've treated enough. And that last one is super important. We'll get that one in a second. Now, there's a few things I'd love for you to pay attention to when you're palpating the skin. One is going to be the thickness of the skin. Is it thick or is it thin? Now, you can really easily tell the difference between thick and thin skin by, for example, touching underneath your ears where the skin, or behind your ears like Sanjiao 17, where the skin is super thin, and then touching around Do 14 where the skin is going to be naturally much thicker. Now, what's really important about this is learning when the skin should be thick and when it shouldn't be thick, or vice versa, thin and shouldn't be thin. A great example of this is when someone has a cold. Oftentimes when someone has a cold in and around Do 14, the skin is going to be really thick in some areas or really, really thin. And so what we're looking for in our palpation always is an area that is different from the rest. I cannot emphasize that enough. If you find an area that is different from the rest, and it should be different from the rest, for example, it's not Taiyang compared to Yang Ming, but like within the Taiyang, there's an area that's different. That's an area you're going to have to treat. Now, thickness of the skin is extremely important, easy to tell. The next is the dexterity of the skin, one that often gets us quite confused. Dexterity, is it really strong? Meaning, is it hard to tear the skin, or is it really easy to tear skin? You can think of someone who is in their 80s compared to skin of a 20-year-old. It's of course going to have more dexterity as the 20-year-olds. So usually with dexterity, we're often talking about skin that is too easy to tear. That's often talking about deficiency. There are instances where the skin is far too taut and way thick. It kind of feels almost like you're going through whale skin or something like that. And that means the thickness and the dexterity is way too tight. And in that case, you're often dealing with excess. Now, the last and final thing that you need to pay attention to is the quality of the skin. Quality meaning, is it soft? Is it saggy? Is it damp? Is it rough? Is it polka dotted? You know, like whatever it is, you need to pay attention to that. In general, our skin should be soft and smooth, unless maybe, you know, they've lived most of their life outside and they're farm workers. And then of course, you're going to have sun damage and things like that that will affect the skin. Now, this kind of understanding of the skin is really helpful when you go into things like treating the face, for example, when they have TMJ, or if you are doing cosmetic acupuncture. These things can really give you hints about what's happening on the face and the structure, and it can also help you when you're treating a newborn when they can't really tell you what is wrong. An example of this is when a newborn has acid reflux and their stomach is hurting and they're screaming all the time and throwing up their milk, and they're also really constipated. In that case, oftentimes they have deficient stomach and the skin around the stomach actually feels quite sallow and thin, and then you can tonify that area. Whereas the areas in and around kind of like the REN 17 area where the acid is consistently coming up and burning the esophagus might be deficient, and it might also be hot and excess depending on what's happening for them for the day. So great, you've understood your palpation. Now how do you treat it with your teishin? That becomes a lot harder to teach in a short little YouTube video, but I'm going to give you some demonstrations on it here. So this is a demonstration of a stroking technique that you could do to treat. When you use a stroking technique, this is often coming from the lineage of the Daishidu style, or what we know here in the States as Tanioka style. It is a very effective style, and one that I usually teach to all of my students in the beginning when they're learning pediatrics, simply because it's really easy to do and pretty effective. Now there's also instances where I use my teishin a lot like an acupuncture needle. And then there's also instances where I use my teishin with my dashin, which is a hammer technique. So there's a lot of different ways to utilize your teishins, and depending on the lineage you learn from, you'll probably use one or the other. If you do end up coming into ShinKyu, again, we usually start with the stroking method, that Daishidu style, simply because it's easiest, and then I graduate most people into utilizing it in other ways once you get up into level 2 Shonishin. So that is my final thing to really mention when you are learning Shonishin. As with all things in traditional Japanese medicine, you must and should always have a mentor. A mentor is going to teach you how to do things, when to do them, and when you did something wrong, why it went wrong, or help you at least think of why it went wrong. That's what we do in ShinKyu University, is really build that foundation so you have a strong core to build upon when you go and learn from people who are way more experienced than me, like my teacher Yasuda Sensei, or his teacher and my teacher Yokoda Kappu Sensei. So I hope you have your running orders on really how to start a Shonishin practice. There is a lot more to this. Building a welcoming clinic for kiddos is very important. As you can see here, I have a little corner where my kiddos can sit. We have books. We also have some toys and things like that. I also have my beautiful clinic dog, Miss Nana. And Miss Nana, who is passed out right now waiting for a walk. She is one of the best ways I've ever found to really help small children get over PTSD. So if you have a clinic dog, so awesome as well. She's actually helped me with several of my little kids that I've helped get over allergies for dogs too, which is really, really cool because she is a short hair breed. She doesn't have as much dander, and so it's really easy to work with that. But so there's a lot of other stuff you can learn about Shonishin, of course. For the sake of this short YouTube video, again, get yourself an amazing tool. If you want, comment below, and I can totally give you suggestions on good tools to buy. Next, you're going to want to start really palpating your patients. If you don't have patients yet, palpate your mother, your brother, your sister, your aunt, your uncle, anybody who will let you practice palpation on. It's a great thing to do. Always do it with permission, because palpating without permission is creepy. And then finally, you're going to want to make sure that you get a mentor. It is really, really important. So I hope you enjoyed this video. Again, I would love to chat with you about your practice. If you are interested in truly bridging the gap between your TCM and traditional Japanese medicine, please do hit me up for a conversation. Again, linked in the description box below. All right, thank you everyone for watching. I really appreciate your time, energy, and effort. If you haven't already, please do give this video a like, subscribe, and hit that bell to be notified of future videos all about traditional Japanese medicine. Now, if you would like to learn more about Shonishin tools and how to take care of them, I would love for you to check out this video right here. It's going to tell you everything that you need to know.